Okay, I have a good idea. Apparently, I know because sometimes people don't know when I start. So they're like, there's no sound, what's going on? I should have some funky background music going on in the background. So maybe I'll do that for the next webinar. If you guys want to give me some musical inspiration and see what I can do. Okay, so again, I think a lot of you have maybe watched some of these webinars. Maybe there's some new people. I'll introduce myself. David Kunashko, I'm a chiropractor, also trained in acupuncture and TCM back in the day. I guess I've been practicing around 30 years now, and I've been involved with what is now called photobiomodulation, or kind of we all know it as low-level laser therapy or low-level intensity laser therapy or cold laser therapy. There's probably like 100 names for it. But now we decided on a really good name, and that's photobiomodulation. So if I'll intermix what I call it, just because it's easier to say laser therapy, to be quite honest. So these webinars are always recorded, and that means that as long as you register for the webinar, then at some point, and usually it takes about a week, although we've moved offices and everything's kind of slow right now getting set up and everything. So it may take more than a week. I can't promise that, but eventually you'll get an email with a link to watch it again. And if that doesn't work out for you, eventually it's posted on our website. If you go to our website and you go under BioCare Plus, you'll see customer support, and then you'll see an icon for webinars. And the webinars are mostly there. So just so you're aware, this one is for, I've geared it towards our personal therapy systems. It doesn't mean that if you have a professional system, it's not going to be of any value to you. But how I talk about using this system for, in this case, hair loss, is specifically for that system. If you have the professional system, there's a lot of similarities there, but I'd have to walk you through. It's a slightly little different because obviously with the professional system, there you can adjust the parameters and so forth. And it's actually a little bit easier, but regardless, you could obviously use a professional system as well. But this one is geared towards this personal therapy system. And I've decided to do this webinar because I tend to get a lot of questions about this, because I know that there's a lot of devices out there, light therapy devices out there. Some are specific just for treating hair loss, right? So I want to talk a bit about that. By the way, if you have any questions, I'm happy to answer those. If you could type them into the Q&A forum, the little box there, Q&A. There's two. There's a chat and a Q&A. The chat is more like if you guys want to chat back and forth and say, hey, how's it going in Manitoba? Sorry you live there kind of scenario, or whatever. But if you want to ask me a question, type it out in the Q&A box, and then I'll get to that at the end of the lecture if that's okay. All right, so let's start. We have about half an hour. I think we'll have plenty of time, but you never know. So I always just talk a bit about, because sometimes people are brand new, just a little bit about what these things are, these BioFlex Personal Therapy Systems. Many of you are aware, maybe not, that the CEO and founder of BioFlex, and the company's Meditech, but the brand name is BioFlex, Dr. Fred Kahn, he actually passed away in his 92nd year, late last year. So we're starting to kind of, announce that. Obviously, there's a few transitions going on, but we have great leadership, and his legacy continues on. A lot of us have been working with Dr. Kahn for decades now. I have been here, I think 12 years now, almost 12 years, I think, or 12, I don't know, a long time. And so we have a lot of other people that have been here a long time too. So we're continuing on his work. We're actually coming up with some interesting new devices, and we're actually now starting to do a lot of research, especially in the neurological world, but some other interesting things as well too. So, if you're interested in that, I do have a little announcement at the end because we need volunteers for a concussion trial. But yeah, so there'll be lots of publications coming out pretty soon. Then I'm going to talk about some of the major types of hair loss. I'm not going to get into all of them. The ones that are probably going to be most common, the ones that we can use a system for, that makes sense. And then initially, I'm going to talk a bit about how hair grows. It's important to understand the cycle and all the rest of it. And then specifically, I'll get into how you're going to use your device to help with hair loss. And it's not just men. I mean, men, obviously it's more common, but to be honest, you may have heard of a little bit of an incident with Will Smith at the Oscars, and we all know what happened there. Of course, there was a violent incident, which I personally believe he should have lost his Oscar for, but whatever. But his wife, who was bald, and that's what the joke was about, suffers from alopecia. I believe, I'm not sure if, what form of alopecia, I didn't get into that. I think it's just female alopecia, which is different than male, but I could be wrong there. Anyway, it's interesting that brought a whole bunch of awareness to alopecia for females, because it is fairly common, and it's probably more of an issue, or more, you might say, devastating for females, because well, typically, females have their hair, and us males, including myself at the top there, lose some hair. So, and depending on your genetics and everything, that's what we're talking about. And of course, always time for Q&A. Just type them into the Q&A forum if you don't mind. So we have two systems. I'm going to talk a bit about the differences at the very end as far as the power goes, but we have a P120 and a P180. Really, the main difference is the size, the number of diodes. Obviously, 180 diodes in the 180, 120 in the P120. Now, these diodes are bicolor, so they emit two wavelengths. So each diode isn't just, you don't have a red and an infrared. They're all emitting red and then near infrared. That's very unique. We're the only company that does that, by the way. Has a lot of advantages because you can pack the LEDs much closer and get a much higher energy density or power density. The controller has a whole bunch of little buttons on it. Basically, if I'm going to treat the knee, I hit the knee button, but you notice there's no hair loss button. And that's because it's a long story, but we didn't get approved for hair loss. But essentially, you can certainly use it for hair loss. We just can't advertise or market for it. So the bonus of our equipment is you can treat your sore knee and your hair loss. Try doing your sore knee with a helmet for hair loss. Not going to work. So at least our equipment can pretty much treat anything and everything in your whole body, plus hair loss. So I think that's kind of a bonus. So you'll notice at the bottom of the controller, it has a power button, turn on, off, a stop to stop the treatment, which comes in handy for this treatment, by the way, because you're not going to, I'm going to explain it, but you're not going to use a regular sequence of events when you use the equipment. There's a pause button as well too. So let's say you couldn't believe what happened at the Oscars, you need to pause it to rewind your PVR, which do people have PVRs anymore? And then watch that again and then turn it back on. And you're going to have stages, which relate to two things. Stages relate to the amount of energy or power, you might say the dosage, but it also relates to something called frequency, where the light's being pulsed out at different cycles per second, as low as 10 cycles per second, as high as 1,000 or 5,000. Or even 10,000. For what we're doing today, that's not so much the issue. We're not going to really need much frequency, but the power aspect does. So I'll talk about that as well. So hair grows. It's actually the fastest growing tissue in the human body, believe it or not. I'm sure we're all aware of that. Undergoes a repetitive and regenerative cyclical changes. You can see this, the stages there listed. Anagen, which is the active growth phase. So when your hair is actively growing, and this can be as long as 6 years, approximately, one hair continues to grow and grow and grow. Then eventually it goes under the next stage, was it involution, starts to shrink up. called catagen. This takes several weeks for that to happen, but you'll see if you look at this little diagram here, you sort of see that underneath the hair follicle, there's what is beginning of a formation of a new hair follicle. So then what happens after that is you have a resting or dormant phase, and that can be as long as a month or a little bit longer. And during this dormant phase, this little tiny, it's called dermal papilla, it's starting to grow, but not producing hair yet. And then eventually, it will start to produce hair, and then the whole cycle repeats. So you can see that if you're trying to treat hair loss, you need to be patient. And sometimes, and I'm going to kind of explain this, it really does depend on what's going on with that hair follicle. And I won't get into, by the way, actually what's going on with these conditions, a lot of huge detail. You can read about that on the internet for the most part, but the most common ones, obviously, is androgenetic alopecia, or, referred to as male pattern baldness. And of course, there's different ways. It usually recedes from the front to the back in different patterns. Of course, that's why it's called that. Obviously, genetically predispositioned. And also, too, by the way, it's linked to a higher incidence of other disorders or issues as well, everything from cardiovascular issues to diabetes and a bunch of other interesting things. So there's probably a series of genetics there involved. Not that the male pattern baldness gene issue is linked to the heart issue, but they're associated, if you know what I mean. So the issue here is that, not the issue, but we know that testosterone is converted to something called dihydrotestosterone, or DHT. And there's receptors on the hair follicle for this hormone. It's an androgen. Now, it's genetically predisposed males, there's an increase in the number of these DHT receptors on the hair cell or the hair follicle cell. So it's actually more sensitive. So DHT actually helps hair grow, but it can also inhibit it if there's too much that's sort of attaching and stimulating the hair. And that's actually what ends up eventually causes the problem. Now, they've isolated a gene called AR gene. That's androgen receptor, by the way, which codes for this receptor. And this is what's thought to be involved. So at a predetermined time, these receptors start to increase in numbers. And that's what makes the hair follicle susceptible to stop growing. There's other things going on too. There could be inflammation and so forth, but this is kind of the scenario that you might be dealing with. In female pattern baldness, tends to start at the part line and then sort of can appear all over the head, so not just in one specific area. Oftentimes at the temple as well, it may start to recede a little bit. What's interesting though is follicles actually remain alive for the most part. So in men, eventually they just die and they're gone, which by the way means you can't do anything about. So for all of the treatment we're going to talk about today, the hair follicles have to be alive for light to do something with. And in the early stages of alopecia, male and especially obviously female, the hair follicles are alive, so you can help them out a little bit. So the reason for female pattern baldness is actually not really understood very well. Sometimes it's just a natural aspect of aging. It could be hormonal, an increase in androgens for a female. Again, maybe a genetic predisposition. They've even related to heavy loss of blood during menstrual flows, certain medications, even some drugs and other things that women might ingest. They may cause issues with that. And some say even stress, that kind of thing. But I'm going to talk a bit about that for the next type, which is alopecia areata, which is a fairly common disorder. It's quite a bit different though. Areata is Latin for patchy nature of hair loss. So that's tends to what you see it in sort of clumps or areas. It's quite distressing if you have it because it all comes out in an area, and you start to obviously be really concerned about that, or most people would be. So the hair falls out in small round patches. It could be as small as like a loonie or a quarter, but it could be even much larger. This patchy hair loss occurs most often, typically, obviously, over the scalp, but actually it can occur in other body areas as well. Tends to affect people from all ages, but we do tend to see it more in adolescence and early adulthood. I didn't have time to include a case study that one of our BioFlex practitioners presented on alopecia areata a few years back. And this was a chiropractor, and one of her patients brought in her daughter who had this condition and asked about it. And sure enough, she had this alopecia areata, and it was quite remarkable the changes that occurred with using the BioFlex laser therapy. Whoops, let me just back up a bit. Sorry, I don't want the rat. This hair loss occurs over a period of weeks, but fortunately and typically it goes back after several months, although it may fall out again. So using red light therapy will actually help these hair follicles to start to grow and hopefully even prevent excuse me, from it occurring again. So this condition, they pretty much think it's autoimmune. You can see this is kind of what it looks like. It's an autoimmune disorder, and they're not really quite sure what's going on there, other than the fact that your immune system reacts to the hair follicles in what's referred to as an antigen way. Antigen is a foreign substance that the body detects as being foreign, and therefore wants to get rid of it. So there's inflammation, and there's a process where the body starts to basically attack these hair follicles and inhibit them from growing or even dying. But remember that you have a constant growth cycle, so that you can get these the hair starting to grow back again. There's lots of potentials here as to what's going on. Maybe there's environmental factors, sometimes even emotional stress or physical injury. It can have a big bearing on your body. This all may provoke an abnormal immune response for people who might be at risk for this. However, in nearly all people, well, mostly that are affected with this type of alopecia, there's really no clear explanation as to why it's going on. They can't, put their finger on it per se. Now, how does photobiomodulation, see that's the word, photobiomodulation or laser therapy, why would it work for this? Well, it was first discovered, by the way back in the 60s by this gentleman, physician Andre Mester. He was actually doing a bunch of experiments using a red laser that he thought was pretty high powered, because he was actually trying to eradicate some tumor cells in the abdomen of some rats. But what he actually noticed was, so he was thinking his red laser, it was a helium neon. No, sorry, it was ruby crystal laser. I think it was around 630 nanometers around there. So it's red. And but it was calibrated lower, so it wasn't as powerful as he thought. So what ended up happening is that when he was treating these rats, what he noticed was that compared to like the control or whatever, the fur or hair, I don't know what it is in a rat, I think it's fur, right? Grew back much faster than the control. So he's like, hey, this is weird, but all right, I'm going to note this down, that this red light, and he realized that it was calibrated much lower, so it was low level laser, had an effect on the metabolism of a hair follicle. So somehow it helped the hair cycle grow faster. And that was the true origin of how this was discovered, just serendipitously. There's my big word for the day. I gotta spat that out there. Discovered this just by accident, right? So photobiomodulation may stimulate follicular stem cell proliferation. Stem cells are stem cells that sort of haven't turned into anything yet, and then they eventually turn into a specific type of cell, in this case, hair follicle. And it could do this by affecting the levels of something called heat shock proteins, and this increases the regulation of cell growth and differentiation. Basically, it kickstarts these cells to grow faster and undergo mitosis or regeneration. So it's believed that photobiomodulation can stimulate the re-entry of the hair follicle back into the anagen stage or the growth stage. It can bring about greater rates of proliferation during the active anagen stage. It can prevent development of premature catagen stage as well. So the idea here by the way, if you're going to use it for thinning hair, you're doing it for the rest of your life. If you know what I mean, like if you have pattern baldness or the genetic kind of scenario, whether female or male or whatever, you're going to have to constantly do this. But if you're treating areata, which is typically shorter term, you can clear it up for the most part. And at the first signs of any loss of hair, you can start treating again, but you don't have to constantly treat it. It can also extend the duration of the anagen phase. So these are all hypotheses and what they feel that photobiomodulation therapy can do. It's also been demonstrated that LLT, which is the O term, low-level laser therapy, can stimulate hair growth through modulation of inflammatory processes and immunological responses. So there is a level of inflammation that may also be occurring with hair loss. And we know that photobiomodulation reduces inflammatory infiltrates, which is just inflammation chemicals. Especially in the pathogenesis of alopecia areata that I talked about, the autoimmune disorder, you get the body creating this inflammation reaction because it thinks it's a foreign entity. So reduction of that seems to perhaps help with that specific condition. Research-wise, there's tons of research. I just want to present a couple papers. This one was specifically using 44 healthy female volunteers, which is the reason why I wanted to present it. All 44 patients had Fitzpatrick skin types 1, I guess that's Caucasian, to 4. I don't know now. And Ludwig, I like these names, Ludwig Savin baldness scale. I wonder if he was bald or she was bald. That would be interesting. Scale 1 to 2 hair loss patterns. Oh, by the way, if you back it up a bit, you can see my reference at the bottom there if you want to look it up. So the hairs in a selected site, they were trimmed. Now, you know what? Most people don't want to trim their hair when they're treating, and I'm going to talk about this. But it's better because you can get more light into the area, but you can still treat it even without shaving your hair, because why do you want to shave your hair if you're trying to treat hair loss? But I don't know, maybe you want to, but if you do, that's even better. But if not, that's okay too. We can work around that. So they trimmed it to 3 millimeters in height, in an area that was about 2.5 centimeters in diameter. Now pay attention to this. They use 650 nanometers wavelength, that's red. We use 660 in the system, so pretty much identical. They used a whole bunch of little laser diodes of a total of 1,360 milliwatts. So the important thing here to note is the power, which is 1,360 millimeters. They put it in like a hat kind of helmet kind of scenario. They treated for 30 minutes, so quite a long time. But note this, 17 weeks, they treated for every other day. And again, the total power 1,360, but note that the power density was 2.3 milliwatts per centimeter squared. I'm going to reference this a little bit later on. They pulsed it. I don't know why they pulsed it. I don't really think you need to pulse it, but they did. You cannot on the personal therapy system pulse it at this rate. You'd have to have the professional one to do that, but that doesn't matter. The pulsing isn't the mitigating factor here. So here are the results. It was applied over the scalp every other day, as I mentioned, for 17 weeks, 60 treatments in total. That's really important to understand that this is going to be taking a while to start seeing the results. Preferably you take pictures even of yourself to see what's going on, but some people don't want to do that or whatever, but you can just visually see what's going on as well. Let me just back that up a bit. So if you look, the before and after, on the left is the before, on the right is the after. That was one patient. On the bottom, before, and then after. You can clearly see there are more hair follicles in each of the treated area of the scalp compared to the before. I mean, it's quite obvious, right? I hope everyone can see that. Okay, so definitely it helped. Another one, they looked at 128 males, 141 females, again, 655 red nanometer, okay? They treated the whole scalp 3 times a week. Notice the idea here is treating about every other day as opposed to every day for 26 weeks. And terminal hair density of the target area was evaluated both at the beginning at 16 weeks and then 26 weeks and then follow-ups. And then here again, you can see the results. What they did here was the before and after, just kind of an overview. And you can quite clearly see here as a female that the hair has grown in much nicer. I mean, hey, bald is beautiful. Don't get me wrong. I'm just saying it's a little thicker there, right? And then if you look clearly, you can see the before, which is C, and then D, you can see quite a few more hair follicles there, which represents that larger picture and showing you the hair. So quite obviously, it's doing something in a positive way. So they concluded statistically significant increase in terminal hair density after the 26 weeks compared to the placebo. Didn't matter if it was male or female, seemed to work and be helpful for both. And they actually said it was pretty much the same as using minoxidil topical solution, which we all know it can also help with this, but again, it's a drug and it may also have side effects and it's probably expensive. I don't know what it is, but end of the day, another thing to notice was that it's helpful to, they realized that by doing longer term trials, you have long-term better results. So in other words, you have to keep treating yourself. Okay, so how are we going to use the BioFlex device? Remember that the device has diodes and they produce red and infrared. Red comes out first, and then it automatically turns into near infrared. So remember that the research I mentioned earlier refers to a power density of 2.34 milliwatts per centimeter squared. That's the most important number, to be honest. Not so much the power, because it's how much power there is in a certain surface area, and that's what's most important. So an RP180, that's a larger one. It's 1165 power, but which you think, oh, it's less. So I'm gonna have to treat longer, but actually, believe it or not, our diodes are more powerful than those lasers. They're especially made for us. So our power density is at 7.2 milliwatts. So 3 times the amount of power density. For the P120, because some of you may have that, you can see that the total power is less, obviously, because there's less diodes. But again, the power density is still pretty high. Not quite as high as the P180, but it's still 6.5. Again, roughly 3 times not quite, if you're being, I know Mark Gross out there in the Gulf Spring Islands is like, can't you do math? I go, okay, so it's slightly under 3 times the power density there. Okay, so how are you going to use this system is that we know that for the most part, red's going to be most effective. You could use the infrared too, but for the sake of following the research and ease of use, as far as time goes, I'm going to suggest you just use the red. So the first, when you turn on the equipment, it's always red light that comes out first, right? So this is what you're going to use on the system. So on your hair. So when you're applying the device and you turn it on, the red light will come out. And then when it turns into infrared, you're going to have to stop the whole treatment and then do it again on either in a different area, the same area, and I'm going to walk you through that. Okay, but we're just going to use the red light. Okay, you'll also notice that our equipment has little tiny raised, little kind of magnifiers, you might say, raised diodes. That's helpful. The reason why that's so helpful is that it displaces the hair follicles. So this is what I recommend, by the way, if you're treating animals as well. And now we're talking about humans, but maybe you're also wanting to treat your friendly feline or your dog, that you move the array back and forth to displace the fur or the hair back and forth so that those little diodes, those bumps actually make better contact with the scalp in this case. So when you put it on your hair, that's what you're going to do is gently move it back and forth until you kind of feel it sink into and then kind of touch your scalp. You will have to, for the most part, hold it on your scalp yourself. I know it may be a bit of a pain. There's also straps. You could use a strap as well too. So a little bit of a disadvantage over, say, a helmet kind of scenario. But to be honest, you could hold it on with one hand and you could do something with your other hand. I don't know, write something or do some cooking or whatever you can manage with one hand. Okay, so what protocol are we going to use? It may sound funny, but it really doesn't matter other than, well, I should say this, not other than, there's some that are better than others. So I'm going to recommend the elbow, the wrist, or the hip protocol. All of those use 8 minutes of red light, okay? And it's continuous wave, it's actually not pulse. So I'm going to say, choose any of those. It's all going to give you 8 minutes of red, and start with level 1. And I'm going to say keep it at level 1. Now, level 1 is basically the full output power that I mentioned earlier. Okay, so for the red, so there is quite a bit of energy there. So remember that hair of all colors is going to absorb light, especially darker colors. So just be aware of that. You may need to adjust the time if you have really dark hair to a little bit longer. And if you have lighter hair or less hair, maybe treat a little bit less, but I'll give you a range, okay? So I'm gonna suggest anywhere from 8 to 12 minutes of red light over one area. Now, I just said 8 minutes is what comes out. So you could start just with that. But if you feel you need to increase it, then what you're gonna have to do is turn it off and then turn it on again and hit the hip or the elbow or the wrist and time it for about another 3 or 4 minutes to get you to that 12 minutes of total, okay? So again, you're gonna hold it one spot. You're going to choose one of those settings. You're going to turn it on, and then, as I mentioned, position it where you need to, and then you're going to hold there for about 8 minutes. And then again, if you're going to increase that time a bit, you're going to stop it, and then you're going to restart it, and then treat that area for another 4 minutes or so. So now you still have, and when you hit pause, if you could do this, you could hit pause at 4 minutes, and then move it to the other area, another area you want to treat, go through the remainder of the 4 minutes of red. So now we're at 4 minutes for that area, turn it off, then turn it back on again, that same area, another 8 minutes will give you 12 minutes in total. I'm hoping everyone can understand that. So the key thing here is treat at least 8 minutes, which sounds like, oh, the other research did 30 minutes. Well, yeah, but their energy density was much lower. Ours is much higher. So it's pretty much the same thing, but you can tweak it up a little bit and go, as high as 10 or 12 minutes if you wish. And that would depend on how you're finding the results, but you're not going to know the results unless you take pictures and or you wait for some time, several weeks to a month, and start noticing any changes a little bit longer. But of course, treatment will take some time. So you may have just one area to treat, you may have multiple areas to treat. If it's pattern baldness, you're going to treat over all the areas where you feel you're thinning, the hair's thinning or what have you. Okay, and female pattern baldness, sometimes it's the entire scalp, so you might have to treat the entire scalp as well. In general, treating every other day is good. Once in a while, you can sneak in consecutive days, but for the most part, as you saw in the research, every other day is pretty good. I mentioned about taking pictures. That's also helpful as well. Start at level 1 and keep it at level 1 and do that for about 2 months of treatment. Level 2 is 90% of the power. So it's slightly less power, but it pulses it out a little bit. That may make a bit of a difference. So, but the amount of energy is pretty much the same, even in level 2 for this. So I'm going to say probably level 1 and just keep it there is probably a safe bet. But if you want to mix it up a little bit, that is okay as well. Remember, treatment is only effective on hair follicles cells that are still alive. If the cells are completely gone, then this won't really do anything. So as I mentioned earlier, androgenetic alopecia requires ongoing treatment. Female pattern baldness, depending on the cause, may just require treatment until hair starts to grow back in normally, or you may have to do it periodically or to maintain it if you're noticing, excuse me, any thinning of the hair, that kind of thing. Okay. I know there's some questions, so just before we get to those, my next webinar, April 28th, is on post-workout relief. So now this is a professional webinar, so it's using the BioFlex Professional System for treatment of delayed onset muscle soreness, and also perhaps how to increase muscle endurance and strength training. So if you have any athletes or yourself want to use it on yourself for that, I'll talk all about that on that date. As I mentioned earlier, we're doing lots of new research, including one in partnership with a device company called NeuroCatch, and we're in Vancouver on April the 23rd. That's next Saturday. We're doing a joint event to talk a little bit about what it is we're doing, and specifically what NeuroCatch is. It's a cognitive assessment tool, determine baseline, and as you start to treat, whether it's with photobiomodulation or whatever else you're doing, to see if there's any changes, basically, change in neuroplasticity, cognitive functioning with patients that may have had a concussion, or trying to improve their ability, their cognitive functioning or ability, either just for their own personal performance or for neurodegenerative diseases or disorders or what have you. We're doing 2 sites for this trial. One in Vancouver, one in Toronto. So if you know anyone that's had a concussion, I believe it's the last 3 months or so, I don't know all the criteria, but you can email Dr. Randy Santiago. He's our clinical research doctor. And his email is, what's his email now? Well, it's ronaldo@bioflexlaser.com. But for this, I think it's, I can't remember what the email is, but anyway, you can contact us. It's coming up. I'll show you the contact info. We're also doing a masterclass, and our keynote speaker is Dr. Norman Deutsch. So if you have any interest at all in neuroplasticity or read his books, try and make it out to this, because I'm going to be interviewing him, and he's also be talking just ad lib about his work and maybe a bit about Dr. Khan. It should be really, really entertaining. He's a great speaker and thoroughly knows his stuff. So right now it's on just for $199. That's an entire day of lectures. We have lectures from South Africa, from Australia. It should be really, really good. And we have our lecturer, neuroscientist, Ryan Darcy. He's the founder of NeuroCatch. He's going to talk about concussion. So if you have a chance, you're interested, then that is on June the 11th, and you can sign up on our website as well. Oh, here it is. The clinical trial, concussion. Oh, you've had a concussion more than 3 months, sorry, not less than 3 months, and you're still suffering from symptoms. And the email is research@bioflexlaser.com. Again, research@bioflexlaser.com. That gets you to Randy or Ronaldo Santiago. We're looking actively for volunteers to get treatment. So yeah, we're also using NeuroCatch to monitor and how things are going there as well too.